Hello, welcome back to my channel. I'm Nurse Jax, and today I'm going to be discussing the signs of a urinary tract infection. Disclaimer: the information in this video is for educational purposes only. It is not intended to diagnose or treat any illnesses. Please remember to subscribe to my channel after viewing the video. What is a urinary tract infection? A urinary tract infection is an infection in any part of the urinary system, which consists of the kidneys, the ureters, the bladder, and the urethra. But most infections occur in the lower part of the urinary tract, which consists of the urethra and the bladder. Women are at a greater risk of developing a UTI than men because of the anatomy of a woman's genitalia. Women have a shorter urethra that allows bacteria to easily ascend into the bladder. The organism that is primarily responsible for the occurrence of a UTI is called E. coli, which is a gram-negative bacteria that's found in the lower intestinal tract. Risk factors for developing a UTI include sexual intercourse. If you have sex and you don't urinate afterwards or clean the vagina, you increase your risk of developing a UTI. Other risk factors include waiting too long to urinate. If you have to go urinate, and let's say you're at work, at the library, at the gym, out to dinner with a friend, cooking, cleaning the house, talking to the neighbor, doing everything except for urinating when you have to urinate. If you hold it in your bladder for an extended period of time, don't do that, because what's happening is you're increasing your risk of developing a urinary tract infection. Other risk factors or other factors that increase your risk of developing a UTI include if you're menopausal, genetics can increase the risk. If you use scented feminine hygiene products, if you use scented bubble baths, you increase your risk of developing a urinary tract infection. Another factor that increases the risk of developing a UTI is if you're hospitalized and they insert a Foley catheter. That can increase a woman's risk or increase the risk of an individual, women or men, developing a urinary tract infection. Symptoms of a urinary tract infection include frequent urination, a burning sensation when you urinate, having a persistent urge to urinate even after you've already urinated, having foul-smelling urine, cloudy urine, hematuria or having blood in the urine, having pelvic pain. These are all signs of a urinary tract infection. Now, what can you do to avoid a urinary tract infection? It's important to drink plenty of water, because when you drink plenty of water, what you're doing is you're diluting your urine and you're flushing the bacteria out of the urinary tract. Drink cranberry juice. Studies have shown if you drink cranberry juice or use cranberry products, this actually prevents urinary tract infections unless it's contraindicated. If you're on certain medications like Coumadin or Femara, or you take omeprazole, which is Prilosec, if you take aspirin or Lipitor, you want to avoid using cranberry juice because it can interact with these medications. Or talk to a medical doctor first before using cranberry juice if you're on any of these medications. Now, other tips you can use to avoid a urinary tract infection include: when you urinate, it's important to wipe from front to back instead of back to front, because you don't want to introduce the E. coli or introduce bacteria into your urinary tract. It's also very important when you have sexual intercourse. You need to make sure you void or urinate after having sex. Clean your vagina, because this decreases the likelihood of developing a urinary tract infection. It's very important to avoid those scented feminine hygiene products. You want to avoid using scented bubble bath. Okay, this too is crucial in preventing urinary tract infections. If you have any signs or symptoms of a urinary tract infection, it's very important to contact your medical doctor, because only a medical doctor can diagnose a urinary tract infection by performing a urinalysis and a urine culture and then prescribing treatment. Thank you so much for watching, and please remember, knowledge is power, and when you are informed, you can make better choices. Please remember to subscribe to my channel. Take care, and God bless. Bye-bye.